Well, if you've ever visited a hospital, and I guess we all have at one time or another, not necessarily as a patient, but just walk down a hallway or retirement home or something like that, you've noticed that there are drawings and paintings on the walls. You can say, where'd they come from? Well, a lot of them come from an organization called Art for Healing, and the assistant director of this particular program is Benjamin Sisson, and he's with us right now. Ben, nice to see you.
Thank you for inviting me.
Okay, you store the art in warehouses in the city, and then at appropriate times, people come and see what's available and bring them back to their organization? Is that a fair summary of what happens?
Yes. So we receive artwork on donation, and whenever there's a healthcare facility that's interested in placing art in their spaces, we invite them down to our storage unit, and then they select the art for their healthcare facilities.
Okay. And is there a particular kind of artwork that works best for facilities like that?
Well, there's been a lot of debate over that.
I'll bet. That's what art's all about.
But we basically have the edict that we don't select the artwork for them. The healthcare facilities know their clientele the best. They know their staff, so they make the selections, not us.
Okay, and how many of those would go to each individual organization? I mean, can somebody come in and say, I need 100 paintings of Mount Tamalpais or something? I don't know what,
Well, it depends first on the size of the organization.
Do you charge them for that, or is it?
There's an administrative fee, but for most organizations that have a small budget for artwork installations, it's very affordable.
Okay, and so they pack up the painting or whatever it is, or paintings, take them to their facility, a hospital, a retirement home, whatever, and they keep it for an indeterminate time. Is that correct?
Yes, and the history of the organization, we've only had 2 returns. So in most cases, yes, the artwork stays.
Is it finders keepers? Is that the philosophy of Art for Healing?
Well, in hospitals and in other healthcare facilities, the patients change, the staff changes, but the art stays.
Okay. And do you get reviews? I mean, will people say that particular artist is a favorite of our patients? Or, I mean, how do you determine what works and what doesn't work? Or does it matter? I mean, it's on the wall, and that's where it is.
We have a very eclectic collection of paintings and drawings and prints and tapestries and sculpture. And everyone I meet has a variety of tastes.
Sure.
So yeah, it's
okay.
It's all
and a lot of these are donations that Art for Healing gets. Is that right? I mean,
yes.
If I have a painting at home that I'm sick of looking at or want to donate, I give it to you, and then that goes out to a hospital or somewhere.
Yes, and we're a 501c3 organization, so there's also the tax incentive.
Okay, so there's another reason for doing that. Yeah. Do you have any requests from particular organizations about the type of art? In other words, can we have a lot of nature paintings or a lot of, fill in the blanks, whatever?
Yeah, I think the most common is colorful images, images with lots of green that have natural colors.
Like flowers and things like that nature. Okay. All right, Benjamin, nice to have you here. Benjamin Sisson has been our guest. He is Assistant Director for Art for Healing. Thank you very much for joining us.
Thank you.
Thank you.